Dr. Schiffman's here. He's an orthopedic surgeon known for his work in upper extremities with Hinsdale Orthopedics. And he also practices out of Good Samaritan Hospital in Downers Grove and at Hinsdale Hospital. And we're discussing the qualities that make a good orthopedic surgeon. If you had to name 3 or 4 top qualities that make a good surgeon, what would you say?
Well, Lisa, this is just my opinion, but I do think that there are a few things that matter a lot. I think one thing, as simple as it sounds, that I listen and take the time to listen, take the time for my patients to really describe what they're going through. It makes making the diagnosis a lot more straightforward. Being a good listener is important, and again, devoting the time necessary to really get to the cause of the problem. Experience matters. I think that I've had the fortune of being in practice long enough to have seen a lot, and I think the experience does help in caring for patients and caring well for patients, and keeping up with what's new in orthopedics and upper extremity surgery. And in this specialty, there is a lot that's new. There's a lot that happens. It's a very dynamic specialty. Ever changing. Yes.
Your expertise is upper extremities. What does that mean?
An upper extremity surgeon is an orthopedic subspecialist who treats problems of the shoulder, elbow, forearm, wrist, and hand.
Any of those conditions?
Yes.
I want to talk a little bit about your health grade ratings because they're exceptional, meaning that when interviewed, people give you high marks. So what's so different about your approach to orthopedic surgery over other surgeons?
Well, again, this is my outlook on things, and it gets back again to treating each patient as an individual. Again, it perhaps sounds trite, but again, it does matter. I consider myself lucky because I have a profession that I enjoy a great deal, and how I care for my patients is how I choose to. It's fun.
And I also understand that you were one of the physicians named by Chicago Magazine in the Top Doctors issue. How does a physician get selected for that?
Well, when I found out that I was selected for this position, it was really the Chicago Magazine that called me, and so it was a pleasant surprise to hear that. I did ask them how the selection is made, and was even more pleased to find out that it was really a survey of my peers. In other words, it was a survey of the physicians in my community, and that means even more to me than perhaps other ways to have done that. I think that it's again communicating with patients, communicating with referring physicians. I think it's critically important when a primary care doctor entrusts me with the care of their patient. I think it's important to let them know what's going on. And there are some situations where I'll get on the phone and let them know what's going on because it's important that they get that feedback quickly.